Hi, this is Dr. Chan here at Crown Dentistry. We've been getting a lot of questions about veneers. So today, I'm going to answer some of those questions, and hopefully that will give you a better understanding of what veneers really are. Veneers are a type of dental procedure that we sometimes use when people want to change either the color, the shape, or the size of their front teeth. You can think of them as kind of like a partial crown. If you know what a crown is basically like a hat for your tooth. Crowns tend to go over your entire tooth and cover the original tooth completely. Veneers are different in that they tend to only cover the part of your tooth that's facing out, away from your mouth. So basically facing the front of your face. So usually people tend to get veneers when they want to change their smile, meaning maybe they don't like the color of their teeth and they've tried teeth whitening and that hasn't really worked. Or maybe they don't like the shape or the size of their teeth. Either things are too small, too big, they're crooked, and maybe they don't want to go through either orthodontics or Invisalign, but they want to change the way their smile looks. These are all reasons that someone might have for wanting to have veneers done. So as we mentioned earlier, crowns and veneers are similar in that they're restorations that are basically placed and glued onto your teeth in order to either change the shape, size, or color of the teeth underneath. Sometimes it's done because there's cavities there, or something broke, or you don't like the shape or the size of the tooth that's there. Veneers and crowns are really good for fixing this problem. I would say by and large, dentists will use a veneer over a crown when maybe the damage or the change to the tooth is not as severe. Sometimes people will have veneers placed on their teeth, even if they don't have cavities or a crack or a broken tooth. Sometimes they just want to change the shape, size, and color of the tooth underneath. In those cases, veneers are very good for fixing that problem. So there are a couple of different things that could happen if you decide to have veneers placed. Some of the best procedures for veneers are when nothing needs to be done to the existing teeth. We call them no prep veneers. What that means is that all we need to do is have you come in, talk to you about what you want to do in terms of how you want the final outcome to look when the veneers are placed. Then we take either images, like basically digital pictures, or we'll take impressions like a mold of your teeth, and then we'll send them out to the lab. We'll talk to the dental lab about how we want the veneers to be shaped and placed. Then they'll make them. Then you'll come back once the veneers are made, and then we basically glue them onto your teeth. Great thing about that is you don't need to get numb. Appointments are generally pretty straightforward, and there's very little discomfort. Occasionally, sometimes appointments will need to be made where we do need to change the shape and size of the teeth just slightly in order to make sure that the veneers will fit properly on the teeth. In those cases, sometimes we will put your teeth to sleep just to make sure that the procedure is comfortable for you. So after the veneers are made, like we said, we have to get the teeth ready to receive the veneers. Essentially, the veneers are glued onto the teeth using a very strong and long-lasting cement. In order to get the teeth ready, usually we have to make the area as dry and clean as possible. So we'll do that. And when the teeth are ready to receive the veneers, we'll glue them on and basically cure the cement with a special light. And once that's done, the veneers are a part of your tooth and you're good to go. A lot of times people ask, oh, are these veneers going to look like my teeth? And the answer is they'll look like your teeth as they are if you want them to. Sometimes, like I said earlier, sometimes people want to change the shape and size of their teeth with their new veneers, and that's totally fine if that's the case. And we can make the veneers either lighter or darker, bigger, smaller than your existing teeth. But sometimes people want to keep the color of their teeth the same, and in that case, we can also match the veneers to your existing tooth color. Porcelain and composite are the two main substances that veneers are made of nowadays. Composites veneers are basically a very high strength, highly aesthetic plastic compound, and those can be made sometimes in the dental lab. Sometimes they can actually be made here in the office as well. Porcelain is a little bit stronger. They tend to look a little bit better. Those also can potentially be made here in the office. More often than not, we will use a dental lab to make those. But the main difference is that, like I said, just to reiterate, porcelain veneers tend to last a little bit longer and look little bit better. Composite veneers, a little bit more cost effective. They don't tend to last as long. And sometimes the aesthetics aren't quite as good compared to porcelain veneers. Once a person has veneers on their teeth, one of the biggest things I tell people is, one, you have to make sure you're good at maintaining your oral hygiene. So being good about brushing, good about flossing, making sure that you don't ingest a lot of sugar on a regular basis. Also, just remembering that these veneers are glued to your teeth, and you're definitely able to eat most foods. I definitely tell people, don't use your teeth as tools. Don't use your teeth with your veneers to rip open paper bags or cut a piece of floss or even crack nuts. I tell people, if you're going to crack nuts, use one of your other teeth. Or honestly, use a nutcracker. But for the most part, it's using common sense and just remembering to take good care of those veneers. So the price of veneers honestly depends a lot on if there's any insurance involved, if you have any other additional coverage. Range on a veneer can be anywhere between $1,000 and $3,000 per veneer. So thankfully, we have a lot of different financing options available for patients who want to finance their treatment and get some veneers. We offer different kinds of third-party financing, such as Care Credit, Cherry. On a limited basis, our office is also willing to do limited payment plans in order to make it so that it's more manageable for you as a patient. A lot of times people ask if their veneers will be covered by insurance. Honestly, it kind of depends. A lot of times we'll ask for a pre-authorization on treatment if a patient is interested in veneers. The way that works is that we can sometimes submit a proposed treatment plan with veneers to an insurance and say why we want to do them. And then we just wait for the insurance to respond to us and to you. Honestly, sometimes insurances will cover it and sometimes they won't. We do our best to try and get the coverage and to craft a thorough narrative as to why veneers would be necessary, but at the end, it's up to the insurance company. Our office is ready and willing to help you if you feel like that veneers are right for you, or if you just have questions about veneers. Please call our office at 285-9678 or visit our website at www.crowndentistry.net. We're here to help.